Today. A very warm welcome to you, Dr. Lau.
Thank you for having me.
Yeah. First of all, Dr. Lau, tell us a little bit about scoliosis. Exactly what is it and what is it not?
Okay. Scoliosis is actually a deformity of the spine. Usually it entails a rotation as well as a sideward bending. And when it's not scoliosis, most spines actually have a bit of a curvature. When it's over 10 degrees or a certain degree, then it's considered scoliosis.
Okay, and what would be some of the most common misconceptions people have about scoliosis?
I think the most common misconception that most people have is that there is nothing that you can do to affect the quality of your health of your spine. And that is the main reason why I've written this book.
Now, some people would think that scoliosis would be more all about posture and the way you look, the way you stand, the way you walk. But how does it, or how can it really affect health in general?
Scoliosis actually has a far-reaching sort of effect in the sense that when people start sitting for long periods or start putting more pressure in through their back, it can lead to more aches and pains as you get older.
Right. So let's say if I have two little boys, and if they were to carry really heavy bags, and over many years, would that cause scoliosis?
Unfortunately, scoliosis isn't just purely a physical condition, and majority of the times, most people think it's poor posture or carrying heavy bags. From what I've known is that scoliosis is a lot more a deeper issue in the sense that it's biochemical, it's neurological, it's hormonal. It's a multifactorial sort of disorder. So it isn't as simple as just poor posture or carrying heavy bags.
Carrying heavy bags, but I think one outcome would be just being short like me.
Oh, me? Oh, dear.
But something that Dr. Lau did say that he said was that it's going to be about 10% deviation from what's supposed to be good posture or
good alignment.
Alignment,
yes,
yeah, that would be the word. Then. How do you measure that 10%?
This is actually measured on X-ray. So on X-rays we can actually measure the definitive degree of the curve through a method called Cobb's angle.
Cobb's angle.
Yes.
Tell us a little bit about Cobb's angle.
Okay. Cobb's angle is actually a way of ruling out on an X-ray the spine and also measuring the angle of a curvature in a spine. It's actually a little hard to explain unless it's visual.
So is this X-ray done with the patient lying down or standing up straight?
Normally it's done standing up, and they normally take a full spine X-ray.
Question 1. What is the guest speaker's occupation? Question 2. What does Dr. Liu say about scoliosis? Question 3. What is woman's concern regarding scoliosis? Question 4. What misconception regarding scoliosis is talked about? Question 5. What does guest speaker say about the physical loads as a cause for scoliosis? Question 6. What method does guest speaker mention to detect scoliosis?